Cognitive behavioral therapy for panic disorder. What to expect. Hey friends, welcome back to the channel. And if you're brand new here, welcome. I'm Zaki, and today we're diving into something real. Like, deeply human kind of real. We're talking about panic disorder, and more importantly, how a therapy called CBT or cognitive behavioral therapy can help you break free from the grip of panic attacks. We're going to cover what it's like, what actually happens during therapy, and what to expect if you're thinking of giving it a shot. No fluff, no scary psychobabble, just real talk from someone who gets it. So, let's start with the basics. If you've ever had that completely overwhelming, heart-pounding, I think I might be dying moment that seemed to come out of nowhere, then yep, you've likely had a panic attack. It's terrifying, right? But imagine that happening again and again, and then you start worrying about the next one all the time. That fear of the fear itself, that's what we call panic disorder. It starts to dictate where you go, who you see, and what you do. You begin shrinking your world just to feel safe. But here's the hopeful part. It doesn't have to be that way. CBT has been life-changing for thousands, and I'm one of them. So, let's break down CBT in a way that actually makes sense. Cognitive means thoughts. Behavioral means actions. Basically, CBT is all about helping you see how your thoughts influence your feelings and your behaviors, especially when panic shows up. You learn to spot the fear-driven thinking patterns that make anxiety spiral, and you gently challenge them. You also start changing how you respond, both mentally and physically, when your body kicks into fight or flight mode. It's not about pretending to be calm. It's about building the skills that help you stay grounded even when your nervous system goes rogue. All right, so picture this. You just booked your first CBT session. Nervous? Totally normal. That first meeting is usually pretty chill. It's all about getting to know you, your story, your panic symptoms, what you struggle with day to day. Your therapist might ask when you had your first panic attack, how often they happen, and what goes through your mind when they hit. Don't stress about saying the right thing. There's no test. They just want to understand your experience and help you feel seen and safe. You'll also talk about what you want out of therapy, like maybe being able to ride public transport again, or stop Googling symptoms at 3 a.m. goals are important. They give therapy direction. Once the basics are down, your sessions will start getting into the meat of it. First, you'll get a bit of a crash course in what's really happening during a panic attack. Spoiler alert, it's not dangerous. Uncomfortable? Yes. But life-threatening? No. You'll learn how the brain misinterprets certain bodily sensations, like a racing heart or shallow breathing, as danger, even when you're totally safe. Just learning that your body's not actually breaking down, that can already take some power away from the fear. Then comes the detective work. You and your therapist will start identifying your personal panic triggers. These could be external, like crowded spaces or being far from home, or internal, like the sensation of a skip heartbeat or the thought, what if I faint? You'll begin noticing patterns, and that awareness alone can be a huge first step. The goal isn't to avoid these triggers forever. It's to face them gradually, in a way that teaches your brain they're not a threat. Now comes one of the coolest and honestly most empowering parts of CBT, thought tracking. This is where you learn to spot those sneaky, automatic thoughts that pop up when anxiety hits. Stuff like, I'm going to pass out, or I'll embarrass myself, or something is seriously wrong with me. You'll learn to break those thoughts down and look at them objectively. Is this thought actually true? Has it ever happened before? What's another way to look at it? This process doesn't make panic disappear overnight, but it does chip away at the fear, one logical step at a time. Okay, let's talk about the part that most people feel nervous about. Exposure. It sounds intense, but hang with me. This is where you intentionally, and in a very safe, controlled way, expose yourself to the physical sensations that mimic panic. Things like spinning in a chair to feel dizzy, or running in place to get your heart rate up. I know it sounds weird, but the idea is to teach your brain that these sensations are not dangerous. You build tolerance, not avoidance. It's actually pretty empowering to look panic in the face and say, I can handle this. On top of that, CBT will give you practical tools for those high anxiety moments. You'll learn slow breathing techniques that actually calm your nervous system. You'll explore grounding exercises to bring you back to the present, and you'll practice letting go of the instinct to fight or escape the panic. Because, as wild as it sounds, fighting panic often makes it worse. The real magic happens when you learn to ride the wave. And with practice, that wave gets a lot smaller. It's super important to remember. The goal of CBT isn't to be cured or to never feel anxious again. That's just not how human brains work. Life will still throw curveballs. The difference is, with CBT, you'll know how to handle them. Panic no longer gets to be the driver. It becomes background noise instead of a blaring siren. You'll rebuild trust in your own body, your thoughts, and your ability to cope. And that's huge. Now, real quick, I want to answer a couple of the most common questions I get about CBT for panic. Will I have to relive my worst panic attacks in therapy? Nope. This isn't trauma therapy or exposure to your darkest memories. CBT focuses more on what you're experiencing now, your thoughts, your triggers, your reactions, and how to shift those. It's future-facing and skill-focused. Isn't it embarrassing to talk about panic attacks? Honestly? No, not at all. Your therapist is there to support, not judge. They've seen it all: racing hearts, tunnel vision, fear of vomiting, fear of fainting. Nothing you say is going to shock them. In fact, you'll probably find yourself thinking, wow, someone finally gets it. You might be wondering how long CBT takes. It's different for everyone, but many people start seeing real results in just 8 to 12 sessions. Some go longer, some shorter. What's cool is that the tools you learn in CBT stay with you long after therapy ends. They become part of how you approach life. You build real, lasting resilience. So let's sum this up, yeah? CBT helps you understand what's happening in your body and mind during a panic attack. It teaches you how to gently challenge the scary thoughts and reduce the fear response. It gives you coping tools you can use on the spot. And it empowers you to stop running from panic and start living your life with more freedom and confidence. If you've been stuck in a loop of panic and avoidance, I want you to know this: there's a way out. CBT is one of the most effective research-backed ways to treat panic disorder, and you are absolutely not alone in this. If this video helped even a little, do me a favor, hit that like button so more people can find it. Share it with someone who's going through it too. And hey, if you're not already subscribed, go ahead and hit that subscribe button and join our community here at Edzakaprat.